Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. Here we are. It is Monday, August 3rd, week
21.
21.
Mm-hmm.
Wow.
Yeah.
Wow.
I know.
It's growing up right before our eyes.
I was going to say, it's like,
Wow.
what is it, like the size of a potato now?
Right, I don't
People
know
track
what
the,
is going on.
the embryonic, anyway.
Okay.
Yeah.
21. Week 21,
Yeah.
everybody. Thank you for joining us. It is our local information program about COVID-19. And today on the program, Jeff Bourgeois is going to be calling in, the president and CEO of San Juan Regional Medical Center. Also, we're going to be hearing from Jyl Adair with Presbyterian Medical Services. She is a Children's Services Manager here in the Northwest region, talking a little bit about how to get kids back, maybe for Head Start and early Head Start classes, and how do you do that in a pandemic.
We'll see what Jyl says.
We will see what Jyl says.
Yeah.
And so I know they've got a lot of plans, and they've been meeting about it, and of course, I know they're going to do it safely and everything else, but certainly we'll be talking to her about some of that. So that's what's going on today, everybody. In the meantime, we do have some numbers and some other things we can share as we start week 21.
21.
With everybody, and I'll get to
Yikes.
those. Oh, and I did want to mention testing this week, too, before we do that.
Okay, cool.
We have from the Department of Health, there's testing today here at San Juan College earlier today. Tomorrow in the evening, it'll be here at San Juan College on Tuesday, August 4th from 6 p.m. to 7 p.m. A new location this week is Bloomfield High School on Wednesday, August 5th from 8 a.m. to 9 a.m. in Bloomfield. And then Thursday, August 6th, back here at San Juan College in the evening, 6 p.m. to 7 p.m. And Friday, August 7th, here at San Juan College from 7 a.m. to 8 a.m. And I'm reading those because of our radio audience.
Correct.
I know people can read it off the screen just like I can, but for our radio listeners, I am reading it off the screen.
Also, again, very happy background. Thank you.
Look at a little rainbow.
Department of Health.
Yeah, right?
Yeah.
Very nice.
Little sun in the corner.
Right. Probably that's week 21. Rainbow is week 21.
Yeah.
So there you go. And there's the other information. Again, the San Juan County Public Health Office, if you need more information, you can call them at 327-4461. And they want you to register before you show up, and that will give you all the information to get your results and everything else that you would need for that. Any of those events this week.
Right.
So there you go. So now we can move on to the numbers, right? Because I know you watch those like a hawk.
I do. I have a hawk eye on the numbers.
You do.
I have a hawk eye on all things COVID.
Yes.
It's a thing.
Right, exactly.
I don't have COVID fatigue like others.
Right.
When it comes to the news.
I
have
appreciate
COVID
that.
fatigue when it comes to the thing being a thing.
Oh, yeah.
That was really eloquent.
That was
the
week 2.
thing is a thing.
That was week 2
Yes,
for all of us, I think.
right.
But yeah, no, we understand. And we really need to stay on top of it, too, because even though you're kind of sick of it and hearing about it, we really need to stay vigilant because that's the only way you're going to knock this thing out. And kind of get these numbers back down. So that's my
I've
point.
actually heard a lot of rhetoric like, oh, now that things have settled down, and I'm like, I don't think that's true, actually.
Not seeing it here.
I think we're just tired, so we're making things up. Like, oh, now that that's gotten better, and no,
sorry.
I mean, I get it.
Right.
Psychologically.
I wish.
But no,
Right.
yeah, exactly.
I think a lot of us are wishing things were a little bit better than they are. But anyway, so you go to Johns Hopkins.
Yes, Johns Hopkins University dashboard. So the United States confirmed 44,511 new cases of COVID-19 yesterday, with 6.1% of the 759,902 tests reported coming back positive. An additional 392 deaths were attributed to the virus on Sunday. That's 2,786 just over this weekend, bringing the pandemic's American death toll to 154,841. Half of 200,000, I guess. I don't know where I was going with that. But anyway.
Right.
Yeah. Lots of people.
Very true. And we can see on the screen we are still leading the world in deaths. Second only to Brazil is behind us, and then Mexico is in third place as far as deaths. In the United States, we can certainly see the number of cases, the 4.6 confirmed cases by county. Seems like a lot of cases, but I guess that's true, right? The 4 million?
Well, it must be. I mean,
that's cases.
Yeah.
So that would make sense.
Cases make sense. Yes.
Yes.
Because there is
4.6 million cases in the United States.
Right, because they're doing, if you have 6.1%, to 9.9%, and you're
Right.
testing up to like 800,000 a day in the U.S. I'm sure it adds
that would
up
get us
quickly.
there. That's
Yeah.
true. Very true. Here in New Mexico, we can update that. Again, we're at ksje.com, our website where we compile this, getting it from the New Mexico Health Department. They update the numbers every afternoon. This is from Sunday afternoon, of course. There were 226 new cases reported in New Mexico yesterday on Sunday, for a total now of over 21,000 in our state. 3 additional cases in San Juan County, which again, these single digits, pretty good. You
Right.
know,
Right.
we like that. 3 additional deaths in New Mexico. None of those deaths were from San Juan County folks, so we appreciate that. There were a couple over the weekend, but again, those numbers are fairly low from what we've been seeing. And the recoveries up by 57. We're now at over 8,300 recoveries in our state, which is great to see.
Yes.
As well. As we scroll on to the next page, you can kind of see the breakdown there, again with the New Mexico numbers, and then next to it the Navajo Nation numbers, which were updated late last night on Sunday. So again, they had 35 new cases across the reservation reported on Sunday, 1 additional death, and their numbers are now at over 9,000 cases on the reservation. Mm-hmm. So that's what we're seeing there. The reservation also reports they've tested 81,000 people on the Navajo Nation for COVID, and so that's how they are doing, and 6,700 recoveries on the reservation, which is great. So good to see that.
Good. Yep.
Exactly. Let's see. Moving on, we can mention again our non-congregate shelter is still in need of donations. I think we talked about this last Monday.
Yes.
But I think it's still worthy of repeating that they could use some donations of kind of toiletry items. As we see it on the screen there, clothing items for all genders and sizes, snacks and books and puzzles, and gift cards to buy things like Alka-Seltzer, Tylenol, things like that. And so this is the shelter that they have set up for folks who need to be quarantined and maybe don't have any other place to go to see if they have COVID, if they've been exposed to COVID, if they develop COVID or not. They need to be kind of separate for up to 2 weeks, and that's what we're talking about.
Right. And so the donation drop-off sites, I wanted to mention that, of course. There they are.
I have them. They're there.
I mean, yeah.
I got them.
I was feverishly looking over here.
I know.
But here they are.
You didn't think I was ready, but I am ready.
I never
We
did.
got it.
Okay, so for the radio audience, we have GC Harvest, which is on 308 West Broadway in Farmington. And they're taking donations Tuesday, Wednesday, and Thursday, 1 to 5. And then with Firehouse Station at number 1, which is on 301 North Auburn Street in Farmington, taking donations every day, 8 to 4.
There you go. And if you need more details, you can call Suzanne Seitziger. She is the shelter site coordinator here in San Juan County, and her number is 320-0514.
Great.
So there you go.
Great.
And that leads us to our first guest.
Excellent.
So there we go. Let's go to the phones. Our first guest who is calling in. Good morning. You're on KSJE. Thanks for calling in this morning.
Good morning, Scott. This is Jeff Bourgeois.
Good morning, Jeff Bourgeois, President and CEO of San Juan Regional Medical Center. Thank you very much for calling in with our, I should say, your update. But we really appreciate that. How are things going this week at the hospital?
Well, they're going very well, Scott. We're encouraged by a trend we're watching. I may have mentioned it before on your show, but one of the metrics we look at daily is the rolling 14-day average of the percent positive test results we receive for COVID testing. And today we are a little under 6% on a rolling 14-day average. We haven't been that low since early April. So we've watched really since July 11th or so our rate decline on a day-to-day basis on that rolling 14-day average. So we believe that's an indicator of a slower rate of transmission of COVID in our patient population, and are encouraged by that. Additionally, we only have 15 COVID positive patients in the hospital this morning. So again, that's the lowest mark in several months. So we're hopeful that trend continues, and again is another sign of a slowing rate of spread within our community.
That is good news. It sounds like, Jeff Bourgeois, and I would say that it seems like it's kind of mirroring the numbers that we see in some of the statistics that we see about our region of the state, that things have kind of maybe calmed down here while they haven't calmed down in other parts of the state, which is what keeps the governor awake at night, I'm sure, and some of her cabinet folks. But is that kind of what you're seeing as well? This kind of jives with the rest of the data that's coming in from Santa Fe?
Yes, that's exactly right. Our region did see a little spike, but it was really attributable to a large number of positives out of a detention center in Cibola County, and really not in. So that anomaly really impacted our calculated growth rate as a region that the state looks at. But all in all, I believe the state is doing well, controlling the spread, and we, I guess if I were to encourage the listeners, Scott, it would be to not let our guards down. The virus is still present in our community, and it can still spread easily if we don't take those simple steps of washing hands frequently, wearing a mask when in public, and social distancing. If as a community we could fully embrace those three things, we could really drive down the rate of spread in our community.
That's right. And I also wanted to just ask about ICU capacity, like maybe there's a percentage or how many folks are there or how are we doing with that? Because that's been a concerning factor in other states is how packed their ICU is. So,
yeah, we're actually doing in great shape there, Megan. Let me scroll back to another report I get daily and take a peek at it. We at the onset of this pandemic, we isolated our regular ICU on the fourth floor to be strictly for COVID patients, and today it's only 50% occupied, so 7 out of 14 beds are full there. 3 of those 7 are very, very sick patients on ventilators. In the non-COVID ICU, we call it, we have 7 out of 9 beds, but again, 4 of those 7 are ventilated. So we have ICU capacity, but as you might expect, the patients in there are very sick, and a significant number of them still on ventilator support care.
Very good.
We have plenty of ventilator capacity. Having those 7 patients ventilated today is not anywhere near our capacity. So overall, ICU capacity and ventilator capacity remains in good shape here.
Good to know. And I know, Jeff Bourgeois, you are in contact with other hospitals and facilities across our state, and so I think we talked about this last week briefly, that it seemed like the plan to manage these COVID cases across our state is working as it was designed, that there really isn't anything overwhelming yet in any of our regions across our state. Is that still what's happening this week as well?
Still very much the case, Scott. And in fact, again, much like us, the state overall is below its peak. And of the 7 regional hub hospitals, well, actually, if you look at the 6 other than us, none are at 100% capacity. So they range from a 63% occupancy rate up to 98% across those other 6 hospitals. And that doesn't account their contingency ICU capacity should they need to flex up into it. So statewide, in terms of ICU capacity, I think we have plenty of it, and could manage another surge if it happens. But of course, that's what we're trying to avoid.
Right, with the advice that you're giving us, and we hear from your doctors too, which we appreciate. And Mr. Bourgeois, do you know, compared to our other neighboring states, we know they've had a tough time. Arizona and Texas, even maybe Oklahoma, I think, is seeing some increased cases. And do you hear how they're doing, or things? I think things are kind of tamping down a little bit, maybe in Arizona and maybe Texas to a certain degree. But what are you hearing?
Well, it's just this, just that, excuse me, Scott. It's what I hear. I haven't really looked at any numbers, but what I hear is that their daily number of new cases is slowing a little bit. But Arizona and Texas have pretty big populations, so there's while it's maybe off of their peak a little bit, it's still very, very impactful to the communities that are hard hit in those states. And So they're not out of the woods yet by any stretch.
So I want to ask real quick about the fatalities, as far as the demographics of the fatalities that you may or may not have the information, but
Well, we see them in those reports, right?
Sure.
That they are of all ages, and we get we've heard that it was, the elderly were most at risk, of course, but we've seen fatalities as young as folks in their 30s, maybe with underlying health conditions. So I guess the question, I'm sorry I interrupted you when you were asking your question.
no, that's good.
But we wanted to ask you a bit about, that folks that are in maybe ICU and on ventilators, there really isn't any set age, is there? You're seeing patients young and old. Are you not, even locally?
Well, yes, and that was really the case early on. I'm going back to right now as we talk here, clicking through some of the previous press release slide decks that are on the Department of Health's websites, and three or four sessions ago, they had some really good demographics about age distribution of COVID mortalities, Megan, as well as some ethnic, metrics about mortalities across different major ethnic groups within the state. So I'm not putting my fingers on it immediately, but
That's all right. We don't mean to put you on the spot, Jeff Bourgeois.
Yeah.
I know you have a lot of resources there that you're trying to share with us, and we appreciate that very much.
Yeah, but what we do know is that the older you are, if you're sick enough to be hospitalized, the higher mortality rate in those older age buckets. Here's something going back to I think it was a June 11th slide deck from the state that as of June 10th, 36% of the fatalities in our state had been over 90, another 30% over 80. So fully, what is that? Call it 66, 67% of all the mortalities in the state were folks of years 80 or greater. And then in the 70 to 79 age bracket, another 15%. So, really, disease really takes a toll on the elderly.
Sure. No, that's very true. And but again, that's true, and we need to be ever so cautious about the elderly in our community. So, Jeff Bourgeois, we appreciate your time again this week. Thank you for calling in.
Very good, Scott, Megan. You guys have a great day.
All right. You too. Thank you so much. That is Jeff Bourgeois, President and CEO of Salmon Regional Medical Center, joining us this week. Again, we appreciate, he always has all kinds of info and insights, which we appreciate.
Straight from the horse's mouth.
That's right.
That's cool.
We love that. And he keeps tabs on all the numbers at the hospital. And again, our thanks to all the frontline folks at Salmon Regional, at other hospitals and across the region for dealing with all this each and every day, because they are on the front lines of this for sure. We have another guest who is calling in.
Great.
Shall we go to the phones?
Yes.
All right. Good morning. You're on KSJE. Thanks for calling in.
Good morning. How are you, Scott?
I am good. This is Jyl Adair from Presbyterian Medical Services. I would recognize that voice anywhere. Nice to have you on with us, Jyl. Thank you. And as I always mention whenever I talk to anyone from PMS, a reminder to our audience that I'm a board member of Presbyterian Medical Services. And so, Jyl, you are a Children's Services Manager here in the Northwest region. And we wanted to have you on to talk a little bit about, the work that you and your team is doing as things get ramped back up here for fall with Head Start and early Head Start and things like that. How are you planning on opening up your classrooms?
Oh, well, thank you for having me. So we are actually in the middle of enrollment, getting everything gearing up, ready for the fall, as you stated. And pretty much what we're doing is going to kind of follow the public schools for right now, which is we're looking at starting off virtual August 17th. And then we will begin to have some children on site on September 8th. And so really we're looking at a reduction in the number of classrooms that we're offering and the number of children that will be physically on our site. So about 50% of those classrooms will be open. We have 7 centers throughout the county. And then those other children will be still doing remote work. So we'll still be serving, all 421 children as our goal.
Great. And I want to ask about sort of accessibility to electronic means, because we know that Head Start tends to work with a lot of populations that are more in need than other populations. And so how's that all shaking out for you guys as far as starting online and people's access to the internet, et cetera?
So what we're doing is really we've done surveys to ensure, what are those capabilities that those parents have in order to connect. So do they have access to Wi-Fi? Do they have a computer? Those types of things. And then that plays a big role into our selection process of looking at who's going to come on site and who's going to be working with us remotely.
Right, and so, and I did have a follow-up question about that as far as eligibility or criteria when it comes to which kids go back and which kids don't. So you mentioned part of it was internet access, but are there other criteria?
So criteria for our program in general, there is criteria in order to be a part of Head Start. And it is truly, like you stated previously, looking at, your income level. And so often people think that, I'm not going to qualify, I make maybe too much money, and we always just tell them, you never know, you need to still fill out your application, because we look at everything within the household over the past year. So it is income-based, and we definitely look at their amount of income that comes in. We look at how many people are in the home. We look at all the factors of, are you now not working? Are you going to school? What are you doing? Those types of factors all play a role in it.
Got it. And Jyl, I wanted to ask you, too, a little bit about the other services that Head Start and Early Head Start provides to these families. And so if families are joining you remotely, are they still eligible for some of the other things that Head Start has traditionally kind of paid for, like wipes and
diapers
and all the stuff you keep reminding me of when we talk?
Yes, absolutely. So we are actually working on a plan right now for meals. Because we do provide breakfast, lunch, and snack, and so we are currently working with CACFP and working just through the Head Start aspect of those guidelines of what we can do in order to provide some meals to those families that will be that will be remote as opposed to on-site. And then for those children that need diapers, we will still continue to provide diapers to them weekly. And that was something we did as well, in March. So, we continued to provide diapers all the way until they came back to us July 7th for this actual school year.
Interesting. And so, and what criteria then would you follow about reopening your classrooms? Would you follow then what the state is saying the schools should be doing? Is that how parents would be able to follow along, or are you going to being independent from those decisions?
Well, we're kind of in the middle.
Okay.
So that's what's been a little bit difficult. We definitely follow the Early Childhood Education and Care Department, their guidance, which is under Department of Health, and then we also have to follow Office of Head Start guidance. And so we have a little bit of flexibility, and we want to ensure that we are meeting all the needs of our community. So our area is a little bit different than some other Head Starts around us because we have 4 different school districts that we work with. And we blend, if you will, because we share services with them, in particular children with disabilities, for example. So we have some, children that may go to a public school for some special ed needs, and then they still come to us for half of the day. So in that fashion, we want to make sure that we are truly, trying to follow that school district schedule. And so that's where, we're kind of having to blend everything together. And we just felt that for right now, the best thing to do was to follow what are the public schools doing, as well as, of course, what our governor states, which is, no kids are really to come on until the 8th. And so I think once we get closer to the 8th and we hear more from her, I think that, things can easily change. As we know, things are changing daily.
That's true.
That's right. So, I have all sorts of empathy on folks that have to make decisions like this in congregate settings.
Or have 5 plans on the shelf or to pull one off at the last minute, whatever.
Part of me is really drawn to that, and the other part is like, oh my God, that's a headache. But
it is. It's hard.
Yeah. So 17th, I know Farmington High School, for example, is going back on the 18th of August. You guys are going back on the 17th of August. And then there's this grand plan to try to start everybody in person on September 8th. And I was just wondering about that, and this may or may not be an answerable question, but that's only basically 2.5 weeks difference. So have you heard any reasoning behind that timeline?
I think it's because she still is wanting us to be, still keeping everything kind of locked down. So I think that's my thought process on that, to let us get all the way through August, and to kind of keep things, still into the groups and us not being out and about as much is kind of my thought process, was what I'm thinking she's doing that for. But when we come back on the 8th, we won't be coming back at 100%. We will still be looking at 50% of our classrooms for right now, just to kind of ease the children back in. We still will continue to follow all of the guidance from Early Childhood Education and Care Department, as well as OHS, which is kind of looking at those staggering the timelines, keeping up with social distancing. We make sure that all the children have their temps checked when they come in. They all have a screening questionnaire that has to happen every day. We have to sanitize the playground in between each group. We have to make sure we're keeping our groups together, so meaning on the playground, for example, we would only have one classroom out, not 3, So that's kind of makes it a little bit harder, because if they have, buddies in another classroom, they're not going out and playing with them on the playground like they used to do. We're making sure that they're not going to the cafeteria to eat. We're having them eat in their classrooms, keeping our teaching groups. We're kind of combining some teachers and ensuring that staff that's involved with those children are the main staff. That we're not pulling in from all the different centers, if you will.
Right,
So,
keeping
yeah.
all those groups separate, which is what we're hearing.
Yeah. Yes.
And it seems like we're hearing stories of folks maybe who didn't do that, and they're having outbreaks or cases in their facilities, whether it's a summer camp or
Right.
or what have you. And so I think there's been a lot of thought that's gone into these plans from your staff and others too in the schools of trying to do this safely. And I guess the delay of after Labor Day is also maybe to see what the numbers are doing across our state, and that gives the governor more time to analyze the cases too.
Right, absolutely. And I think that will give, our thought is if we do it, if we want to call it a soft open, or how you kind of want to look at that on September 8th, and I think that way if we can at least provide that support to those families that, are truly working and, really are needing, that child care to get them in, as well as those that we spoke earlier, that may not have the means for technology and those things, because we are not like the public schools. We don't have the funds to provide laptops and internet and those types of things.
Gotcha. And so, Jill, before we go this morning, would you please repeat maybe how folks can get a hold of you or your staff if they want to know if they can apply, or to get their application in to see if they would qualify, and if Head Start or Early Head Start could help them in their family situation?
Sure, absolutely. They can come by any one of our 7 locations throughout the county, particularly coming to 608 Riley Avenue. That's here in Farmington. And they can come pick up an application. Within it, they'll have all the checklist of everything that they need to bring in. It's, typically a copy of your birth certificate, your shot record, those types of things, and, of course, your income over the past year. But there's a whole checklist of everything that they need in order to fill that out. They can also, again, go to any one of our 7 sites. We're located in Bloomfield, Aztec, up at the Little Feet site, which is around Nappy, so Kirtland and all that. But, really, I think it's easiest just to come here at 608 Riley Avenue in Farmington.
Okay, and that location, as I always tell people, it's right across from City Hall, basically. If you're not sure where Riley is, it's off of Municipal, and there you go.
Yeah, absolutely. Right down from the police station. I tell them if you don't curve with the road, you're going to run right into our parking lot.
That's true. Very true. Well, Jill, thank you for calling in this morning and sharing your plans with our audience, and we wish you well and good luck, and we'll have you on again with an update.
Okay, sounds good. Thank you so much for having me.
All right. You're very welcome. Take care. You're welcome. That's Jyl Adair from Presbyterian Medical Services, Children's Services Manager, and that's a lot.
That's a lot.
Isn't
That
it?
is a lot.
Right?
It's a lot.
When you got little kids and trying to keep them separate, and that's what you have to do.
Right.
So,
and then, they're sticking things in their mouth every 2 seconds. I mean, that's a hard group to corral.
yes.
They're not exactly putting it together,
Well, you're right.
Right. I mean,
They're
they're
just
not
kids.
old enough to
They're
put
doing
it
their
together.
kid thing.
But yeah,
That's
they're
what they
doing
do.
their kid thing, licking their shoes, touching the light sockets,
Hopefully
touching
not.
each other,
Okay.
pulling their
Thanks.
mask down.
All right.
And
Apparently that's your childhood.
Yeah,
But thank you for that insight.
Pretty much. Well, also, like, I think it's just so hard. I mean, it's terrible when it comes down to the socialization aspect.
For all kids.
For all
You bet.
kids, you can
You bet.
imagine.
Right.
My best friend's over there. Why can't I? You know, that's
Right.
tough.
And I know that's
tough for
what a
kid.
lot of parents are going through right now is because the kids miss their friends, they
Sure.
miss school, they miss sports, they miss all that group activities and things like that. And so I think it's really hard for parents to try to explain that to kids, or
Yeah.
maybe try to not try to get their kids cheered up even when the parents are bummed about it.
Right.
So
Yeah.
that's
Kids
tough.
aren't very good in the long game thinking, of course.
Right.
So.
That's difficult, but we're all in this together, as
Yes.
we've said, for 21 weeks.
Right. 21 weeks so far.
So far.
Yeah.
That's true. So before we go,
Yes.
you wanted to share another story that you
Yeah.
have found about it
Mexican beaches.
could only be happening during this pandemic.
La Playa.
Yeah.
The BBC News.
Love them.
Yeah, love them. Big fan because we actually pipe
We're the
them in.
affiliate of
Right,
BBC News.
Right,
That's
that's
true.
right.
Yeah.
So cool. Anyway, they had a story about some gentleman who dresses up like the Grim Reaper and walks the beaches because Mexico is the third highest COVID case nation. It's us, Brazil, Mexico. And the beaches are still closed in Mexico, which you can imagine would be very hard for them. And that's like their mega tourism. That's their gold, right? Gold mine. And so anyway, but there's all these funny pictures of this guy dressed as the Grim Reaper just walking by these beachgoers, and I love it. I mean, I've been really fascinated by just COVID creativity in general. You know, I don't know if you know that Taylor Swift released a new album and she wrote it all during quarantine. Did you know that?
I did know that.
You did know that?
I did not.
Oh, okay. This is why we have me as DJ and
Yes,
you
thank
as
you.
news.
You're right. See?
Yeah.
You add that certain je ne sais quoi to the show every
Je
time.
ne sais quoi.
Oui, oui.
I didn't know you were French.
Yeah. That's about it.
That's about it. Just that.
There you go.
Are you
I was
trying to
looking-
pull up a picture?
I was looking for some pictures and I don't see the story. I'm not saying that you made it up because I know
No.
you didn't because I saw it on your phone.
That's right. Yeah,
So-
I came across.
But
the
I was
phone,
trying to
so
find it.
Anyway,
But
but
I don't.
highly recommend. Well, I think there's actually numerous. I think there's like a movement for like it's kind of like a weird subtle vigilantism. You know, throw on a Grim Reaper outfit and troll the beaches. It's
Right.
just interesting.
Yeah. To remind people to.
Stay off the beaches. This is dangerous. At least where they're at. I guess that's a high spread area for those folks. Anyway.
Yeah, that's true. Well, we've heard it numerous times on this program to maintain all the precautions, to wear the masks, wash your hands, don't touch your face, social distance, physically distance. That's how we're going to get these numbers down,
right.
and how we can maybe get back to in-person schools and sports and some of these other things that folks really want to do, in-person dining and all those things. That's the way to do it.
That's right.
All working together.
Yes.
So there you go.
Cool.
So anyway, we will be back on Thursday, everybody, with our other edition of our local information program about COVID-19. So we hope you'll plan to join us at 9 a.m. this Thursday morning. And again, of course, this is rebroadcast at noon on the KNMI Vertical Radio. We appreciate their support. And again, on KSJE Radio every afternoon at 5 on Mondays and Thursdays. But until Thursday, have a good week, everyone.
See you next time.
Stay safe and stay well. Bye-bye.